So today's topic is diet in cancer, page number 475. Those who have the new edition textbook, you can mention the page number in the chat box. Page number 475, chapter 21, diet in cancer. If anyone is joining late, please help them out with the page numbers. So before going on to cancer, you have to understand what's oncogenes. Onco means related to cancer. Genes, it's your genetic material within the nucleus. Okay. So, oncogenes means what? Cancer causing agents will do some changes at your DNA level. Okay. And that changes, that mutation, okay, will develop a normal DNA and convert it into an activated oncogene. Okay. So cancer causing agents are carcinogens. Okay. Carcinogens or cancer causing agents. These come through your food, pollution, certain chemicals that you are exposed to on a day-to-day life, radiation. Okay. Certain infections like human papilloma virus and all. Okay. These viruses do tend to cause cancer in the human body. Okay. So any carcinogen means cancer causing agent at your DNA level, it will cause a change. It will cause a mutation. Okay. It will, and this change you can see here. Okay, that what the carcinogen is doing, it creates a change in the proto-oncogene. It's a prototype. Okay, it is in a suppressed form. Every cell is capable. Every cell has a potential to be a cancerous cell, but there are numerous factors within your DNA, okay, that suppresses this potential. Remember this, every cell in your body has the potential to become cancerous, okay, but there are suppressing agents within your body. We will discuss that later in one of the Wednesday classes. We will discuss about cancer in detail. Okay, so a proto-oncogene will be formed, and that will activate the entire DNA and make it into a cancerous cell. So what's happening at DNA level? When the cell has got these changes, it has become an oncogene. Okay, it was earlier just a proto-oncogene. Now it is an activated oncogene. Activated oncogene will convert this entire cell into cancerous cell. It will divide, it will multiply, it will divide, differentiate. Okay, and tumor will be formed. Cancerous cells will spread. Okay, so this is how cancer happens at the DNA level. Okay, so that's how a normal cell that has a proto-oncogene, which is usually suppressed, but too much of carcinogens can cause a mutation and activate this oncogene. And with this activation, a normal cell became a cancerous cell. So this cancerous cell will divide, multiply, proliferate, differentiate, and become a tumor. And further, it can become cancerous. It will spread all over the body. Okay. So is it clear so far? At the genetic level, how cancer starts? So classification of cancer depending on the location. Okay, this in detail we will study tomorrow. Tomorrow I'll take cancer on Wednesday classes. So with examples you will see in detail. Okay, so right now carcinoma, it means cancer of the epithelial cells. Where do you find the epithelial cells? In your skin. Okay, your cheek. Okay, you touch the inside of your cheek. Okay, that is epithelial cells. Okay, that's a tissue made up of, that entire area is made up of epithelial cells. Your mouth, your throat, breast, lungs, lining of the lungs, okay, lining of the throat, trachea, lining of the intestine, these all are epithelial cells. Okay, so when an epithelial cell is involved in cancer, okay, it is called carcinoma. Sarcoma, cancer of the bone, when bone cells are involved. Okay, in cancer, they are called sarcoma. Okay, bones or muscles or any connective tissue. Then leukemia, cancer of the blood forming organs like bone marrow. Okay, so any abnormal growth in the bone marrow, it will lead to leukemia. Then lymphoma, you have lymph nodes, lymphatic system is there in your body. Lymphatic system is supposed to drain out all the infectious agents from your body. Okay, you have a lot of lymph nodes in your underarm region, okay, near your neck region, in your inguinal region, okay, in your intestine you have Peyer's patches and all. They all are a part of the lymphatic system. Okay, lymphatic system is supposed to protect you from infections. Lymphatic drainage also takes place to drain out all the toxins and bacteria and virus that you're always exposed to on a day-to-day life. Okay, so if these organs of even the lymphatic vessels, if it is affected or lymphatic nodes are affected, we call it as a lymphoma. Okay, there are more classification, more of that we will discuss tomorrow in tomorrow's session. Coming to the risk factors. First is, what are the risk factors of cancer? Heredity. Cancer runs in your family. Okay. There is a strong tendency, especially when it comes to first female relatives. If mother had suffered from breast cancer, grandmother had suffered from breast cancer, there are high chances the daughters of the current generation and the next generation are also at a high risk of developing breast cancer or ovarian cancer, colon cancers. These all cancers run in families. Okay. Lung cancer as well. Then you have environmental factors. So environmental factors, under that you have ionizing radiation. We will see that in a bit, ionizing radiation, chemical substances. Okay, we will see that soon. Dietary factors from your diet. Okay, meat, energy balance, uh, red meat, insulin resistance or sugar, certain fats, proteins. Okay, these can also lead to cancer. Estrogens, too much of estrogen or estrogens through hormonal replacement therapy. Okay, once a woman attains menopause and all, she will be put on hormonal replacement therapy. So that would lead to breast cancer. Okay, am I audible to all? Then you have some metabolic syndromes that could lead to cancers. For example, if you have pancreatic cancer, colorectal pancreatic cancer in males, and breast cancers in females. Okay, so these are related to metabolic syndrome. Those who had suffered from diabetes or insulin resistance for a long period of time, okay, they tend to have this. With age, the risk of developing cancer increases, especially after you cross the age of 65. The risk of developing cancer is 6 times. Okay, as compared to a person who is in their midlife. Physical activity, lack of physical activity, sedentary lifestyle. Physical activity can also protect you against specific cancers by reducing the body weight, reducing the body inflammation. Okay, if you are obese, your body is in an inflammatory state. And inflammation over inflammation untreated, when it is chronic, it can turn cancerous as well. Then immune factors, certain multifactorial disease conditions, certain autoimmune disease conditions, if it is unchecked, that could lead to cancer. And even the risk of cancer is increased when you suppress your immune system. Okay, patients who have undertaken some transplantation, okay, they undergo immunosuppressant therapy. Okay, they have to keep their immunity suppressed for a while so that their own immunity will not attack the new organ which they have received. Okay, so if that is taken for a long term, and also people who suffer from autoimmune diseases, they are also on immunosuppressant therapies. Okay, so when the immune system is suppressed, remember your immune system can also suppress the potential of developing cancer. Okay, so that potential will also get affected and risk of cancer increases. So coming to environmental factors, ionizing radiation like X-rays, gamma rays. Okay, people who work in the radiology department, they have a high risk of developing cancer related to radiations. Okay, that's the reason why they have to wear dosimeter whenever they are working in the radiology department. They have to wear dosimeter, and every 2-3 months, dosimeter will be sent to BRAC, Baba Atomic Research Center in Mumbai, to identify how much radiation this person has been exposed to. And when the results come back, then the hospital duty rotation will change. If a person has been exposed to radiation for a high levels of radiation for a week or for a month, they are not supposed to be in radiology department. They will be posted somewhere else. Okay, so based on the rotation, and pregnant women should not be posted in radiology department. Okay, they should not come near X-rays and all. These strategies are used in hospitals. Okay, to protect the uh, people who work in these departments where they are highly exposed to radiation, nuclear medicine department as well. Okay. Then certain chemical substances are called, which are called carcinogens, like benzene, asbestos, tobacco. Okay. These are also chemical that has carcinogen. Cancer caused by tobacco is very common in India: lung, mouth, larynx, esophagus, bladder. Okay. Consuming pan with tobacco, that causes leukoplakia, that is cancer of the epithelial cells inside your cheek. Okay, you can see that from the in the mirror. And even the use of BDs. Okay, then certain viruses like human papilloma virus, Epstein-Barr virus, these are the two viruses. Primarily in human beings, it will cause cancer. So against we about phones, Wi-Fi, we do not know much. Okay, these are very new concepts. Definitely they also have the potential. It's not that they will not. They do have the potential, because yeah, wherever Wi-Fi is used, Wi-Fi also uses some amount of radiation. Phones also emit certain radiations. Okay, but so far what they say, it is safe for human beings, the amount of radiation you expose through phones. Okay, but when you're surrounded by hundreds of devices like that, okay, it also creates an atmosphere of radiation. Okay, so there is a potential, there is definitely a potential, but that area is yet to be explored. Okay, we can't make a conclusive statement right now. So human papilloma virus, Epstein-Barr virus, are oncogenic in humans. Vaccines are available for this. Then you have stress. Stress can also damage your thymus gland. Thymus gland is part of your lymphatic system, your immune system, and that can suppress the oncogenic factors. Then coming to dietary factors, usually after the age of 16, and once a woman has turned into an adult, after 16 or 18, you are supposed to take the vaccination of HPV. Coming to dietary factors, meat. Which type of meat do you think is most oncogenic? Yes, it is red meat. Red meat. Okay, not poultry meat, red meat. beef, lamb, mutton, okay, they all come under red meat. So red meat, it has been proven because there is a association between people who are regular with red meat and the development of colorectal cancers in that population. Okay, even in India, the states that consume a lot of red meat like beef and all, okay, the states like Kerala and all, they have a high incidence rates of colorectal cancers. Okay, so there is an association between red meat and colorectal cancers. Vegetarians, the risk of developing colorectal cancer or any colon cancer is very low. High intake of fish sauce, which is used in Japanese cuisine, Korean cuisine, okay, that is also a risk factor of gastric cancer. And if you cook poultry or fish, okay, like the chicken meat and all, and fish, if you're cooking it at high temperatures, that can also turn carcinogenic. High temperature cooking should be avoided, like roasting, okay, deep frying. These things should be avoided. Boiling and all is fine. Stir fry is also fine. Sauteing is also fine. Then energy balance, body weight, and development of uh, cancer. I have mentioned it earlier. Studies have seen that increased risk of breast cancer, endometrial cancer, gallbladder cancer, kidney cancer is high in women who are obese, okay, especially in post-menopausal women who are obese or overweight, okay, whose waist hip ratio is high, okay. So these cancers are, the risk of this cancer development is high in obese or overweight women after the post-menopause age. Yeah, barbecue as well. Then we have sugars, consumption of simple sugars like too much of monosaccharides and disaccharides in your diet, simple sugars, okay? That is also related to colorectal cancers. And any food whose glycemic index is high and that is being consumed on a regular basis, high glycemic index food, not good for diabetics, okay? That also leads to cancer. Then fat, diets that are high in animal fats like ghee, butter, okay? And high amount of omega-6 fatty acids, not omega-3, omega-6 fatty acid, that can also increase the risk of colon cancers, breast cancers. High intake of any fat, not just animal fat, but with animal fat, definitely the risk is high. Then protein, increased meat intake also leads to colon cancer. Vitamins and minerals, if you don't have enough carotenoids in your food, okay, like beta carotene through yellow, orange fruits and vegetables, okay, low beta carotene level has an association with lung cancer, okay. Low dietary vitamin C has a link with oropharyngeal cancer, stomach cancer, gastric cancers in general. If your diet is low in vitamin E, lung cancer, cervic cancer, colorectal cancer, because these are good antioxidants, okay. Carotene, um, beta carotene, vitamin C, vitamin E, okay, they all are really good antioxidants. Then alcohol, too much of alcoholism, too much alcohol issues in women or men, okay, high consumption of beer also, okay, that also increases the risk of colorectal cancer. It damages the liver, it causes cirrhosis of the liver, and this is what precedes liver cancer. Okay, after cirrhosis of the liver, the next stage is liver cancer. And some people give up in liver cirrhosis stage itself. Aflatoxins, like the fungi that grows on cereals, groundnuts, okay, that can also cause liver cancer. Beta carotene supplements. Research has shown that when lung cancer patients are supplemented with beta carotene, the severity of the disease also increases. Supplements of beta carotene, not the natural beta carotene. Beta carotene is supposed to reduce the risk of lung cancer, but once it has developed, once the liver cancer has developed, and if you start supplementation of beta carotene for the cancer patient, it increases the symptoms. Coming to the signs and symptoms of cancer, you can remember this mnemonic caution. Okay, with like the mnemonic you can see on the left side, it's caution. Okay, each word stands for a specific area which you should be focused on. Okay, if you find these all symptoms within you or anyone in your family, you have to get them checked. Okay, even in the textbook, similar, they have not given the mnemonic. Okay, or all yellow, orange, red fruits and vegetables are rich in beta carotene. So C is change in bowel or bladder habits. Okay, that is a common sign of colorectal cancer specifically. Okay, the way the crucial schedule that you may be following for your daily evolutions. Okay, that may change. Okay, you may feel like going to the loo. Okay, or going to void urine any time of the day. Okay, it is not fixed, so that could be a sign of colorectal cancer. Then a sore that does not heal. Okay, especially if it is located on your skin, in your mouth. Okay, in skin cancer, oral cancer. Okay, that could be the reason of it. A sore means a small wound or a sore that does not heal. Then U stands for unusual bleeding or discharge. Okay, from the bladder, from the vagina, or even when you pass the stools, okay, from the rectum, there is unusual bleeding, fresh blood, okay, not the clotted blood, it's the red fresh blood. So that could be a sign of prostate gland cancer in men, cervical cancer in women, okay, colorectal cancer in both. Okay, so that is unusual bleeding. U stands for unusual bleeding. T stands for thickening or lump in the breast or anywhere. Okay, so breast self-examination, there are steps to it. Okay, how can you do the breast self-examination? Women can learn this. Even if you check YouTube videos, you can learn this and uh, do breast self-examination at least once a month to find any lumps under the surface of your breast. Okay, and if you find a lump that moves, okay, immediately do a mammography, and further the doctor will give you advice to if you require a biopsy or not. Okay, or is it a serious matter or not. So thickening or lump in breast or anywhere else, in men, if it is a testicle, okay, that could also be a sign of testicular cancer. Then indigestion or dysphagia, not able to swallow properly or not able to digest food. Okay, you are always bloated, okay, nauseated. So that could be a sign of stomach cancer, throat cancer, esophageal cancer, mouth oral cancer, okay, indigestion or dysphagia. Then obvious change in a wart or mole. Okay, you may have moles on your body, black, brown spots. Okay, you may also have wart on your body. Wart. Okay, wart is kind of a very keratinized, protruded surface on your skin. Okay, usually on your fingers or on the back of your palm. Okay, even inside of the palm you will find, on your legs also, toes and all. Those are the common areas where warts are found. Okay, so if the size, shape of the wart or a mole is changing, okay, or it has become sore, it is not healing, okay, that could also be a sign of skin cancer. The nagging cough or hoarseness, which runs for a month and it is not reducing. Cough that lasts for 4 weeks or longer can be a symptom of lung cancer or throat cancer. Then you have general systematic. So, general systemic reactions, abnormalities in metabolism when cancer starts. Okay, abnormalities in metabolism. Either you suffer from it, you will suffer from extreme weight loss. Why? Because the cancer cells, they develop very rapidly. Okay, in a very small span of time, they multiply, they proliferate, they develop, and they require a lot of nutrition, they require a lot of energy to do this. So the energy that is supposed to go into other regular cells for your regular functions, okay, these cancer cells will be like the parasites that will take away the nutrition, energy, other requirements to keep up the growth. Okay, so that usually leads to weight loss and weakness. Okay, because glucose is not metabolized properly, it is taken up by the cancer cells. Okay, and many people patient during this period, they develop insulin resistance as well. Okay, drugs can be used, like metformin can be used to correct it. They also take up protein, not just glucose. Tumors take up protein also, and at the expense of the host. So host, that is the human body, the other healthy cells, they are not getting the protein that they require, but the tumor cells are taking away all their protein and glucose. Okay, so this, and the body goes into a state of catabolism. Okay, if from the food the host body cannot acquire, the host body will break its own muscles, okay, other areas from where amino acids can be derived, other protein based areas in the body. Okay, that's how the body goes into a state of catabolism. So that's how a person becomes very weak, okay, loses a lot of weight during cancer. Anorexia, not feeling like having food. Okay, it could be led by depression as well. Okay, a person who suffers from cancer, their mental health is also affected apart from physical health. Okay, so they may go into a state of depression after knowing that they're diagnosed with cancer. So that could lead to anorexia. Okay, depression and anorexia go hand in hand. A person who is depressed, they usually lose their interest, they lose their appetite, they lose their interest in food. And on top of that, if it is an oral cancer, esophageal cancer, there should be something stuck in, they feel like something is stuck in their throat. They can't swallow properly, dysphagia, indigestion. Okay, these are other factors that will cause the person to go into anorexia, not wanting to have food. Okay. Then wasting, that is muscle wasting, which I have said earlier, protein is also taken up by the tumor cells. So body goes into a catabolic state. Catabolic state means body breaks its own glucose stores, its protein stores, fat stores for survival. So that leads to wasting. They will lose their entire muscle mass. You can see their bones through. Okay, bony prominence on the body, that will be very visualized. Okay. Then malabsorption. Um, intestinal villi is not able to absorb nutrients properly. Okay, especially if it is any colorectal cancer, and this is associated with steatorrhea. Okay, too much of fat is not digested. If it is a pancreatic cancer and all, pancreatic juices will not be produced. If it is a liver cancer, bile juices will not be produced. So there is nothing to tackle fat that enters the body. As it is, big globules of fat, as it is, will leave the intestine. So that leads to steatorrhea, diarrhea. Okay, malabsorption follows that, especially in case of pancreatic cancer, liver cancer, or any cancer that is obstructing the bile ducts. Okay, bile ducts, they pass through pancreas and they end in duodenum. So if a tumor happens in pancreas, it is growing and it is obstructing the bile duct. Okay, so bile salts, even if it is produced, it is not able to, bile juice is not able to reach till the duodenum. Okay, so that is how malabsorption happens. Then fluid electrolyte imbalances, gastrointestinal lesions will lead to general malabsorption, and definitely diarrhea is there, steatorrhea is there, the person is not having enough food, anorexia is there. Obviously, they will go into a state of fluid electrolyte imbalance. Okay, you get your electrolytes from your food, from the drinks that you drink. Okay, so along with all these digestive symptoms, okay, indigestion symptoms, anorexia symptoms, wasting symptoms, okay, they are malnourished, but on top of that, they may be dehydrated. Fluid electrolyte imbalance is also there. Okay, anemia, definitely, when malabsorption can affect all the other nutrients, all the other areas of nutrition. First, it will take its toll on iron absorption, because iron absorption already, it's a very tricky area. Iron absorption is a tricky area. When we will do the chapter of iron, we'll discuss that in detail. But there are various factors, various checklists that you have to do, check. Only then iron absorption can happen. Okay. So it will go into a state of anemia. The person will go into a state of anemia. Taste and appetite will change. Okay. Especially if the chemotherapy has begun. With chemotherapy, there is a lot of symptoms, side effects that a person has to manage. Okay, their appetite and taste completely changes. Even the smell of the food can make them nauseated, and it will lead to spurts of vomiting. Okay, then learned food aversion, especially it happens after chemotherapy. You are soon after chemotherapy, whatever kind of food you are eating, and you vomited, you felt nauseated and you vomited. Even as a non-cancerous person, you must have you ever experienced this in the past? You had some specific food, and soon after that it led to indigestion, gastroenteritis, or you nauseated or you vomited. Will you feel like having the same food again in the coming next month or 1 year? Okay, you must have experienced this kind of a situation with any of the food, even in childhood, especially in children. Okay, once a child eats something and vomits, it is very difficult to give the same food to the child in the future. Okay, that is learned food aversion. Okay, associated with indigestion. Okay, some food, as soon as you eat it, you feel gastroenteritis, in indigestion, and then you tend to avoid it completely. Okay, you think that it will always cause a problem, so you avoid it. So that is learned food aversions. Then hypercalcemia, too much of, because body is going into a state of breaking itself down for survival. Definitely the bones will also break, not literally break, bones will undergo demineralization. Okay, because calcium is not being absorbed by the intestine, body requires calcium. Okay, the heart contraction and relaxation requires calcium. Any form of contraction and relaxation in the body requires calcium. Okay, so that goes, so a lot of calcium from the bones will be taken up. Okay, parathyroid glands will be very active. They will take up all the calcium, maximum majority of the calcium from the bones. It will demineralize your bones. But what's happening here? Too much of calcium is now in the blood. Okay, that is hypercalcemia. Then osteomalacia, if the bones are getting degraded from the by the calcium, the next thing that will happen is osteoporosis or osteomalacia. Or what is osteomalacia? Softening of bones. Why softening? Because all the minerals, especially calcium, which is supposed to make the bone hard, okay, that was taken up by the blood. Okay, so that leads to soft bones, softening of bones. That is osteomalacia. Okay, is it clear to all the general systemic reactions? So, cancer therapy treat cancer. There is either any one of these therapy a an oncologist may choose for you, or it could be a combination of two therapy or all the three therapy in combination. It will be chosen depending on the stage of the cancer, what the patient is going through. Okay, what is the chances of recovery? Okay, what is the chances of recovery? What is the survival rate of the patient from this cancer? Based on all these factors, okay, a treatment option will be chosen. It may include surgical treatment, radiotherapy, chemotherapy, all in one, or any one form of treatment, okay, or combination of two. Okay, so oncologist is the person who will be deciding this. Okay, but each of these therapy, it could be surgical, radiotherapy, or chemotherapy, each of this therapy has its own side effects. Okay, food aversions during pregnancy, usually it will subside after you have given birth. Okay, that morning sickness phase, it usually subsides by second trimester and third trimester. Okay, the things that were making you nauseated in the first trimester, usually it subsides by second and third trimester. Okay, very rarely it stays for women throughout the pregnancy, but after pregnancy things get better. Okay, so surgical treatment. So in surgical treatment, definitely after surgery, your diet changes, okay? At least for 1 week or 2 week, okay? The after any form of surgical treatment, for example, if you are doing a surgery for the jaw, okay? Jaw is being removed because oral cancer was there. Because of tobacco use, tobacco use, pan use, okay? Oral cancer was found and a segment of jaw was removed. Will this person be able to eat normal food? You must have seen this before, like going to theater, they show you advertisements on this. They will not be. They will be put on NG tube feeding. Okay. So definitely the status of nutrition, what it was supposed to be before surgery and after surgery, even though it is NG tube feeding, it will have its side effects on the nutritional status. Okay. Variety of food will decrease and the creativity will not work that much with cancer patients, and the mechanism problems, like if the patient is on NG tube, any ostomy has been done. Okay, gastrectomy, that is removal of a part of the stomach, okay, which may have cancer, so that could lead to dumping syndrome. Stomach becomes too small to accommodate food. Okay, so the food will not stay in the stomach at all. Whatever you eat, immediately it will go into duodenum, into the intestine, and you will have to rush into the bathroom. Okay, soon after having food, you within 10 to 15 minutes, you will have to rush into the bathroom. So that is dumping syndrome. Okay, that will happen because as a side effect of surgical treatment. Vagotomy means it's an operation in which vagus nerve, you have different nerves, okay? That vagus nerve is cut, okay? To make sure that gastrics, the way how gastric emptying takes place or secretion takes place. Okay, especially if it is peptic ulcers. Okay, peptic ulcers happen because there is too much of acid in the stomach, one of the reason. Okay, and if the peptic ulcer is happening because too much of acidity in the stomach, you have to make sure that the stomach secretes less acids. Okay, so you will have to cut the vagus nerve that the stomach requires to secrete more acid. So that is vagotomy. Okay. And if pancreotomy is done, pancreotomy is again removal of a part of pancreas. Definitely, you will lose a lot of insulin. Okay, insulin secretion, glucagon secretion, pancreatic juices secretion. These all will fall down. Okay, the entirety of pancreas, what it is supposed to give you, and half of the pancreas, it will give you, is completely different. Okay, so these are the nutritional problems in surgery. Next is radiotherapy, nutritional problems in radiotherapy. So it produces a lot of inflammation, whichever area you focus the radiation. Okay. It's not that radiotherapy is very precise, it is precise to a larger extent. But do you think healthy tissues are also getting destroyed to an extent when you are targeting a part of the body with radiation? Along with tumor cells or cancerous cells, do you think healthy tissues are also getting in the way? It will, okay? Radiation therapy, however, whatever precision you use, to a degree, you will be targeting healthy cells as well. Okay, so that leads to inflammation. That leads to inflammation. Okay, so if it is done on the throat, esophagus, and all, it will lead to swallowing problems, dysphagia, loss of taste sensation. Okay, uh, because continuous radiotherapy will damage the healthy cells of the tongue, so you will not be able to find taste in whatever you eat. Okay, it would lead to anorexia, nausea. Okay, if if it is a stomach cancer or colorectal cancer and you're using radiotherapy for it, okay, healthy cells of the intestine, that will also get destroyed. Okay, in that process, so that will lead to diarrhea, malabsorption. Okay, so definitely all of these will impact the appetite of the person. Okay. Next, in chemotherapy, and also adequate nutrition support has to be followed in radiotherapy so that you can reduce the impact of side effects. Already the person is weak with cancer. You don't have to make them more weak with these therapies. Okay. So you have to focus especially on nutritional status. Okay. Special focus is given there when a patient is undergoing radiotherapy. Then in chemotherapy, a lot of gastric symptoms. Okay, like nausea, vomiting, anemia. Okay, toxicity. Chemotherapy is like the drugs that you use is supposed to kill cells. It is cytotoxic. Okay, drugs used in chemotherapy is cytotoxic, toxic to the cells. Okay, so this also at an extent it will damage healthy cells also. Okay, so that's why you see a lot of symptoms like this. It is killing some healthy cells as well. So the toxicity level is quite high. So some side effects of cancer therapy and suggested dietary management is given on page number 485, table 21.3. You can go through that. Okay, like nausea and vomiting, what you have to do if the patient is suffering from nausea, vomiting. Okay, dry mouth, what actions should be taken. Okay, targeted actions to relieve the patient from that distress. Taste alteration, loss of appetite, sore mouth, sore throat, swallowing problem. Okay, early satiety means even if they have one slice of bread, okay, they will feel full. That is early satiety. Okay, feeling full with very less amount of food, they will not have anything more. So they're depriving themselves of nutrition. So in these kind of situation, what has to be done? So nutritional requirements, energy, and the objective of nutrition therapy here is to make sure that the metabolic demands are quite high in cancer. Okay, body is in a state of catabolism and all. So the BMR, basal metabolic rate, is quite high. Okay, so you have to meet the demand of the metabolism. Okay, otherwise the body will stay in a catabolic state. Instead of improving the person's body nutritionally, the patient will become more weak and weak. Okay, losing a lot of their own healthy cells, tissues, okay, in catabolism. So that is one of the main focus of nutrition in cancer therapy, to make sure that metabolic demands of the body is met, and to also alleviate any general gastric issues, whatever they have, to alleviate that, to reduce that also, treatment will be given. Okay, so energy, at least 2000 kilocalories for adult patient has to be maintained. You can be liberal with carbohydrates here. Okay, protein 80 to 100 gram. Okay, slightly on the higher side. High protein diet has to be maintained, because catabolism is our first focus. So to prevent catabolism, high carbohydrate, high protein diet can be given. Okay, fat, we will still restrict the fat a little bit, because fat absorption and metabolism depends on the type of cancer. Okay, if it is any obstructive cancer in the pancreas or liver, okay, you have to reduce the fat intake. You will have to focus more on high carbohydrate and high protein diet. Okay, so generally we will give a protein rich diet to the patients. Micronutrients supplements are recommended. There is no other way. Okay, because high carb diet does not meet all the nutritional requirements. Okay, fluid, avoid dehydration. So what, based on the patient's weight, the amount of water that we suggest is based on the patient's weight. Okay, for every 20 to 25 kg, 1 liter of water you should have. Okay, so that is a person who is weighing 50 kg, at least 2 liters of water they should have. Okay, the upper limit is 4 liters, not more than that, whatever is your weight. Okay, so avoid dehydration. So minimum 2 liters of water, even intravenously if you're giving, including that as well. So you can see a plate here. 1/4 of the plate is protein, 1/4 of the plate is carbohydrates, and half of the plate is rich with um, healthy complex carbohydrates and fiber rich food. Next, it's a dietary management. When it comes to nausea and vomiting, clear, cold, carbonated drinks should be given, which has certain levels of monosaccharides and disaccharides, which is easy to absorb in the intestine. Okay, give them a straw, that so that they should not gulp it down. Okay, slowly they have, sip by sip, they have to drink the any beverages what you provide. Okay, small and frequent meals that is low on fat has to be given in nausea and vomiting. You can give dry food, okay, like khakras, glucose biscuits, rusk, bread, toast. Okay, don't give them liquid or semi-liquid diet, because if they nauseate and vomit, everything will come out in one shot. Okay, if you're giving dry food, it is difficult to project it out. Okay, any carbonated beverages. Okay, fruit juices can also be given here. Then you have dry mouth, at least 2 liters of water or at least 2 liters of fluid should be maintained on a daily basis. High calorie beverages are preferred over water. Okay, so that's the reason why you can give carbonated drinks. Okay, like Coca-Cola. Okay, these things can be given. Not on a daily basis, but whenever they suffer from these kind of situations, when they suffer from these situations extremely. Okay, in that situation, carbonated drinks can be given. Taste alterations, experimenting with different flavors and seasoning, substitution of other proteins for red meat. Okay, so try variety, get creative. Okay, it's a trial and error method you have to use here. If one thing doesn't work, immediately shift to something else. Okay, don't try to repeat the same thing just to try to force the person to eat it. Okay, keep trying, keep doing the trial and error method. Whatever works, stick to it. Loss of appetite, small frequent meals can be given that is high in calorie. Okay, high protein snacks can be given, high protein beverages, high calorie beverages can be given. Sore mouth and throat, soft non-acidic food that is blended or liquidified so that they will not have to chew it or they will not have swallowing trouble. And usually food at room temperature can be given because if you give some hot food or lukewarm food, that could also burn their mouth if it is sore. Then swallowing problems. Don't give highly seasoned food, spicy food and all. Avoid it. Liquid feeding is better. Pureed food. Okay. Boil vegetables, puree it. Okay. And then give it to the patient. Tube feeding, if it is suggested, NG tube feeding is started. Add butter and sauces to food to make it calorie dense. Finely chopped food so that they will not find it difficult while chewing and swallowing. Then early satiety, as I mentioned earlier, frequent meals. Avoid food that is high in fat because fat increases your satiety levels. Okay. And if you're giving any water or juice or any beverage to the patient, don't give it during mealtime. At least 1 hour before, give something to drink. Okay, keep a 1 hour gap and then give them the food. Otherwise, their stomach will be full only with the beverage or water, and they will not eat. So, is the dietary management clear to all? Whole grains can be given. Okay, processed food should be avoided. Vegetables and fruits as much as possible. At least 5 to 9 servings of vegetables and fruits because antioxidant rich food. Okay. Soya bean as much as possible can be given. Red meat avoid. Omega-6 fatty acid avoided. Milk can be given. It's a beverage that is calorie dense. Refined sugar don't give them. Stevia can be used. Omega-6 is high fat content. Okay, it does not suit well with colorectal cancer patients. Okay, not omega-3, omega-6. Some nutritional supplements which are commercially available, like antioxidant supplements and all, which is available if the patient is not eating a lot of vegetables and fruits because of appetite issues, you have to depend on supplements. Anyhow, even if you're maintaining 2000 kilocalories, okay, you have to be dependent on nutritional supplements. Supplements cannot replace your diet, but it can at least make sure that the options of malnourishment are reduced. Okay. So whey protein can also be given to the patient so that especially those who have satiety problems. Okay, if you eat a protein rich food, it will make you full very easily. But if you have a protein supplement, okay, your protein requirements can be met and you will not feel that full. You will still have the space in your stomach to eat something else. Okay, so use whey protein whenever and wherever required. Mushrooms like reishi mushroom, maitake mushroom, button mushrooms. Okay, they are known for its anti-carcinogenic properties, anti-inflammatory properties. Okay, reishi mushroom has an immunostimulant property. It enhances your immunity. Okay, it is anti-inflammatory as well, anti-tumor as well in nature. Maitake mushroom. Okay, that also has anti-inflammatory benefits. Button mushrooms, which generally in majority of the Indian households we still use, it is easily available. That has phytochemicals, antioxidants that can block certain estrogen-based cancers. Okay, which decreases the production of estrogen. Or even if the patient is on hormonal replacement therapy, if they eat a lot of button mushrooms, it will not trigger their breast cancer. Next, coming to prevention. There is no conclusive studies yet that long-term intake of supplements would lead to certain problems. Okay, as long as your blood studies don't show you any deficiency. Okay, if you, as long as your macros are covered. Macros means your protein, carbohydrates, and fats, they are covered, and you're aiding your nutritional status with supplementation. There is no issue with that. Okay, it's just a matter of convenience. Okay. So, cancer preventing food, beta carotene. Okay, it reduces the risk of lung cancer, but after lung cancer has developed, beta carotene supplements can aggravate the situation. Okay. Vitamin C, it reduces the risk of gastrointestinal tract cancer, cervical cancer, cardiovascular diseases. Okay. Vitamin E decreases the risk of oral cancers, pharyngeal cancer, cardiovascular diseases. Selenium can reduce the risk of esophageal cancers, uh, stomach cancers. Flavonoids are phytochemicals found in green tea. Okay, any form of teas. Okay, supplements will not damage kidneys or liver until and unless you are abusing it. Okay, too much of calcium supplements, definitely your risk of calcium stones will increase. Okay, if you are having a healthy liver to begin with, you are not alcoholic, you don't smoke. Okay, you are not putting a lot of toxins in your body, you have a healthy sleep wake cycle, your liver is healthy. Okay, and liver does not have to work a lot to metabolize supplements. Liver definitely has to work a lot to metabolize drugs. Drugs and supplements are two different categories. Okay. Specific drugs, your liver has to work a little bit more to metabolize it. Okay. To detox it. Supplements don't require detoxification from liver. It aids in your nutritional status. Okay. All the different types of carotenoids like beta carotene, lutein, lycopene. Lycopene is found in tomatoes. Okay, uh, having red tomatoes. Instead of having raw tomatoes, saute the tomato a little bit in olive oil. Okay, that use spinach. Okay, so use olive oil, use your spinach and put tomatoes as well. Okay, the lycopene present in tomatoes will enhance the absorption of iron in spinach. Okay, and the olive oil will activate lycopene. Olive oil, sauteed tomatoes will activate the absorption of lycopene. So instead of just having raw tomatoes, having a little bit sauteed. not completely cooked and roasted or burnt tomatoes. Okay, having a little bit sauteed spinach and tomatoes. Okay, it's much more healthy. Okay, beta carotene, which is found in carrots. If I ask you a question, is it better to have raw carrot, or is it better to have a sauteed or steamed carrot to get maximum beta carotene out of it? It is steamed or sauteed carrot. Okay, raw carrot definitely has beta carotene, but the bioavailability is not that high. Raw papaya will have much better bioavailability, not raw carrot. If you saute carrot a little bit, or if you steam your carrots and then have it, the beta carotene present in the carrots will be better absorbed in the body. Okay, so cooking plays a very important role. The kind of cooking you use, the methods of cooking that you use, it plays a very important role in enhancing the absorption of antioxidants. Okay, how long should you cook green leafy vegetables? Not more than 5 minutes. Green leafy vegetables never cook more than 5 minutes. Okay, whichever form of cooking you may be using, blanching, boiling, sauteing, okay, steaming, whatever you're using, don't cook it more than 5 minutes. Okay, these are the sources of phytochemicals. Table is given in your textbook as well. That's a small table, table 21.5, phytochemicals and their sources. The one that I have shown on screen, it is a little bit longer version. So you can just look at the food source. You don't have to look at the specific phytochemicals. Just look at the food source. Take a snapshot of this food source in your mind. These are antioxidant rich food that can reduce the risk of cancer. Okay, and it can be added into a cancer patient's diet to give them that additional dose of antioxidants, which will help the treatment as well. That is ongoing. Okay, onion, garlic, leek is not that easily available in India. It's a French cuisine. Chives, chives are very similar to spring onions. You can use substituted with spring onions. Tomatoes, carrots, watermelon, spinach, turmeric. Turmeric is used in all Indian cooking. Okay, so abundantly it is used. Grapes, blue or strawberries, blueberries, all the berries. Okay, all berries are packed with antioxidants. All citrus fruits, berries, green tea, green leafy vegetables. Okay, cruciferous vegetables like broccoli, cauliflower, cabbage, Brussels sprouts, legumes, all the seeds like flax seeds, sunflower seeds, pumpkin seeds, watermelon seeds, peels of citrus fruits, cherries, nuts. Which nut do you think has the highest antioxidant? Which nut do you think have the highest antioxidant? Yes, it is walnut. Brazil nut comes second. Walnut has the highest antioxidant level. Okay. Whole grains, legumes, beans. Okay. So these are the different types of phytochemicals and their sources. Okay. And also prebiotics and probiotics have a lot of buttermilk, curd, yogurt, okay, kefir, sour cream, and that has live bacteria, lactobacilli. Okay. Pickled vegetables, fermented food, pickled vegetables. Okay, they are also good sources of pickled vegetables in form of, it is pickled in sugar and vinegar water. Okay, with some spices. Okay, these vegetables, keep it for a week, use it for the week, make a next batch. Okay, every week make one batch, finish it in a week. These are good sources of probiotics. Prebiotics, these are asparagus, wheat bran, or like when you need dough for making chapati. Okay, don't sieve it. Don't sieve it. And when even if you're sieving it, whatever bran is left, pick up all the stones and put back the bran back into the mm, dough. Okay, and then knead it. So wheat bran should go into in your stomach. Garlic, banana. Okay, these are prebiotic food. These are food for the bacteria in your gut. Okay, gut microbiome will be very happy. All fiber rich food. Okay, insoluble fiber rich food. Your gut microbiome biome will be very happy. Resistant starch. When you cook green bananas. Okay, green bananas are sweet, but they're green in color. They are not extremely ripened. Okay, green bananas, but they look green, but they're sweet. Okay, uh, and overripe banana, don't use it. It should not be complete. Bananas should not be completely ripened. That has resistant starch. And plantain, green plantain. Okay, green plantain is used in Indian cooking. Okay, green plantain is the one that is used in banana chips, the Kerala banana chips that you make, that is made up of green plantain. Okay, it is used in cooking as well. Just like how you cook potato, how you use potato in certain dishes, you can substitute green plantain in that. Okay, so that is a good source of resistant starch that will improve the quality of the microbiome and gut bacteria. Okay, so if you treat your gut bacteria well, a lot of preventive and chronic diseases can be cured. Okay, so that is the recent medical approach, the dietary approach to cure certain diseases. Microbiomes are the recent fad in the medical community. Okay, beans, brown rice, lentils, muesli, oats, unrolled oats, potatoes. Okay, they all have resistant starch. Potatoes, after boiling the potatoes, you have to let the potato to cool down. Okay, after boiling the potatoes, let the potatoes to cool down. They will form that resistant starch. That is good for you. Okay, do you think eating cold rice or previous day's rice is good for you? You had cooked white rice yesterday. You kept it in fridge and you're eating it today. Is it good for you? It is. It is an abundant source of resistant starch. Okay, previous day's rice is good, especially for diabetic patients. Okay, if you're cooking white rice right now and immediately you're consuming hot steaming white rice, if you're immediately consuming, it will drastically increase the blood sugar level immediately. But if you're cooking the white rice right now, you're waiting for at least it to cool down. Okay, or you're putting it into the fridge and using it as a fried rice option for the next day, or you have leftover rice in the fridge, you're using it as a fried rice option, something like that, the next day. It has become resistant. The starch that were loosened while cooking, it will condensify again, and now your stomach has to work a little bit more harder to break it down. So the glucose spike will not be that easy. It will be a very slow spike. You can reheat the rice. You can definitely reheat the rice, because when you're doing the fried rice thing, you're heating the oil, you're putting the vegetables, and you put the cold rice, okay, just to change its temperature. You're reheating the rice just to change the temperature to a palatable temperature. That's it. Okay, even with keeping it in fridge, there is no harm. With fridge or without fridge, there is no harm. Okay, fridge will not do any harm to the uh, rice that is packed in a airtight lid. Okay, brown rice already has bran. Rice bran is already present in brown rice. Okay, Then a lot of dietary fiber, especially insoluble fiber. Okay, it protects against colon cancer, prevents gastrointestinal cancer diseases, controls your high cholesterol levels, reduces inflammation. Okay, helps in weight loss. If you suffer from piles or any such diseases, that can be reduced. Okay, so that is the importance of dietary fiber. Obesity and cancer, the relation is given. See, as I mentioned earlier, when you have too much of calorie than what you're burning, you will become overweight and then you will become obese. It will not happen in a night. Okay, you become overweight and obese over a period of time. Okay, so during this entire phase, the body is undergoing inflammation. Why? Because you're suffering from insulin resistance. Okay, what is insulin resistance? You are giving yourself food. Food is being broken down. Glucose is being released into the blood, but the cells are not accepting glucose. Okay, insulin is released to help the cell open their doors for glucose. The cells are not responding to insulin. Okay, so what happens? This glucose will stay in the blood sugar level will stay high for a long period of time, and this is an inflammatory situation. This is hyperglycemia. Okay, high levels of glucose in blood for a very long time, hyperglycemia. And that would lead to what's happening, what the cells will think. We have to make more cells to produce more energy, because our host is not giving us glucose for energy. The thing is, they are not responding to insulin to today take in glucose and make energy. Okay, so cell proliferation means genesis of cell. Okay, more cell will be produced in the body, more cells will be produced in the pancreas. Okay, because pancreas will think the insulin that we are producing is not enough, I guess, so let's produce more cell which will secrete more insulin. So everywhere cell proliferation is taking place, and anywhere a mutation can when this cell proliferation is taking place at a high level, okay, from in different parts of your body, it will just take one cell to undergo mutation and produce an activated oncogene and lead to cancer. Okay, so this is how obesity is related to cancer. Is it clear? So that's all for today. I hope you understood this session. If you have any queries, you can mention in the chat box.